Patient is a 75-year-old Caucasian male. Patient presents with abdominal pain and melena. Patient presents with a distended belly, like Santa Claus, but without the jolly laugh or the reindeer. Patient presents with 2 children, 6 grandchildren, and 4 great-grandchildren who will never see him outside of this hospital again. Patient presents with a history of drug abuse and an unidentified pain that can only be cured with oxy. Doctor presents with a headache. Patients, no matter their age or skin color, all present with one unifying symptom, a distressing case of being human. Patients present with diseases, but they also present with lives, families, fears, and hopes. They didn't teach about that in med school. Patient is a 24-year-old Hispanic female. She has gestational diabetes with her blood sugar climbing every appointment, but what her doctor doesn't see is that if this mother is given the choice between a salad for 1 and McDonald's for 5, her family will win every time. Patient is a 32-year-old male, and he's in with a gunshot wound to the hip, but all the doctor can see when they look at his hands is the wounds those hands inflicted on his wife when she sat in the same bed 3 weeks ago. The doctor picks up his chart and puts it back down. This should be the moment where she questions everything, but her title isn't Your Honor. It's Doctor. Patient is a 22-year-old female with scars on her wrists that went just a little too deep and tears on her mother's cheeks that feel just a little too familiar. Patient is a 34-year-old doctor who has seen too much and saved too few and pushed too long. They are burnt out, an overused light bulb. They build walls, shutting out every patient's story, every patient's heartache, putting their heads down and getting through the day. So doctors teeter on tightrope, striking the dangerous balance between cold and calculating and perilously vulnerable. Because somehow the emotions, carefully checked at the door, didn't know they were supposed to stay there. But are these emotions so easy to get lost in, only there to ensnare the rational doctor? Or are they something more? Maybe instead of traps, these ropes are supposed to help to climb higher, to experience more inside the walls of a hospital than just the thrill of a puzzle solved. Hearing the joy in a patient's voice when they finish their last round of chemo. The wide eyes of an infant as they take their first breaths in this brand new world. An addict who finally has the wake-up call to take back his life. These are not just puzzles. They are people. Patients are inextricably linked with the stories that created their symptoms, and in the immortal words of Osler, it is much more important to know what sort of a patient has a disease than what sort of a disease a patient has. So despite the pain and the frustrations and the confusion, doctors push on, learning the stories, feeling the emotions, loving the patients. Because there is a difference between treating a patient and treating a patient like a human being.